It is 6 months since Nigeria recorded the first case of COVID-19. Today, the country has recorded more than 50,000 confirmed cases and about 1,000 deaths. However, the good news is that there have been recoveries, and this has come with misconceptions and stigmatization. Today on the show, that is our focus. I am Olasumbo Mudukwe. Welcome to the show. We begin the show with COVID-19 update.
Schools resume this week. Administrators have been advised to identify a sample collection site where students who develop COVID-19 related symptoms can have their samples collected for testing. The Nigeria Center for Disease Control added that schools should provide adequate hand washing facilities and ensure that students, teachers, and visitors wash their hands, as hand washing with soap and water is an easy way to prevent the spread of COVID-19. Lagos State Governor Babajide Sanwo-Olu has approved the resumption of all public servants on grade level 1 to 12. The directive is in accordance with the recommendations of the Presidential Task Force on COVID-19, an advisory of the State Ministry of Health. All accounting officers are to ensure strict adherence to all safety protocols, guiding against the spread of the virus in their respective MDAs, just as duty rosters must be maintained in all state government establishments. The World Health Organization Director General, Tedros Ghebreyesus, is self-isolating after coming in contact with someone who tested positive to COVID-19. Dr. Ghebreyesus is well and without symptoms, but will self-quarantine over the coming days, in line with the WHO protocols, and work from home. Globally, there have been more than 46 million confirmed cases of COVID-19, including above 1.1 million deaths reported to the World Health Organization, over 62,000 confirmed cases, and more than 1,100 deaths have been recorded in Nigeria.
It is still Sound Health on Lagos Television. Joining me now via Skype is Lekan Sote, a journalist, broadcaster, and columnist with the Punch newspaper. Lekan Sote will share his journey as a COVID-19 survivor with us. Welcome to the show, sir.
Thank you. Good afternoon, Olasumbo.
Okay, how does it feel to have just recovered from COVID-19?
Okay, before I answer your question, let me first say that I went for another test, and less than a week ago, I got an email from the center that I tested negative.
Wow.
This time. So that means I'm free of, Now, how does it feel to be, shall we say, a patient or victim of COVID-19? It's a dreary and fearful experience, because two things. The information out there is very scary. So when you hear that you have COVID-19, you are really scared, and so that was my experience. But maybe I'll let you know my experience at the isolation center also.
Okay.
If you ask me.
I will definitely ask.
But it's a dreary, knowing when you get information, you are scared.
Okay, so how did your journey start?
Okay. Well, I started having fever. And I think the rule of thumb is that if you treat fever for 3 days, it will go. And if it doesn't go, then go and see your doctor. And that is exactly what I did. On the third day, or even fourth day, I then called a friend who is a medical doctor. You know, this social distancing thing.
Yes.
You don't, so I had to call, and then he also recommended, I told him my problem. He said, okay, I should take malaria prescription again for another 3 days just to be sure. So meaning that he started his own administration. So after 3 days, I took it. I wasn't getting well. So that's going to about a week now. And I went back to him. I called him again. He said I should go and take a blood pressure. So I took it, and I think the most dangerous part of it is the systolics. Usually, I'm told that I have a normal BP measure, but this time it was 163 systolics. So I called him back and told him. He said that's quite high, and he said I should take some drugs to bring it down, which I did, and then it went down to 93. He was quite worried about that. So, and I told him that, but still, I was still taking the malaria drug. So after the third day, I called him back and said, well, okay, I've completed the thing, but I'm not feeling better. So he recommended that I visit a diagnostic center that everybody knows at Oshodi. I'm sure you know the place.
Yes,
I don't know if I'm allowed to mention their name. So I was on my way to Oshodi when I felt dizzy. I was going to take it. I didn't want to drive, and I didn't want anybody. So I said, let me go take a cab. So as I was about to take the cab, I started feeling somewhat uncomfortable, like dizzy, you know. But I was close, luckily I was close to Lasut. So I went over there, I met a doctor, and I told him my problem. Then he listened to me. You know, he said, well, his best guess is that I probably have COVID-19. So I said, okay, I went back. I bought some immunity enhancing drugs. Took them for about 2 days. I felt relief the first day. The second day, I started getting bad again. So I called the doctor again. That, look, this thing is starting. And then now, apart from the fever now, I was now having shortness of breath.
Okay.
You know, I'm told that everybody does not have all the symptoms. You will have some, and other people will have the others. But essentially what was scary for me was the shortness of breath. So I called him back, and he said, maybe I need to go to the isolation center. I said, that's fine with me. So I went there, and one of them was writing, one of the doctors was writing some tests that he thought I should undergo. And a word came from the medical director, who is known to the doctor that referred me, that, look, it's better you admit this person and then do your own tests in-house, which is exactly what happened. So on that Sunday night, I was admitted. They put me into a room. So the following day, they came to take the necessary samples, and they started treatment right away. And I think the being very quick to start with the treatment process was a very good initiative on the part of the doctors there. Because I like to think that if they had waited for the result, which came rather late, I do not know if I would have been alive. Okay. So treatment started, and then thank God I'm here.
What was your reaction when you were confirmed positive? Did the result change anything, or your thoughts about COVID-19?
Well, like I said, it was a hunch, it was an informed guess that maybe I was positive, you know, and then when I went to the isolation center, as I had said earlier on, the test hadn't been done. But I think looking at me, the doctors figured that this person probably needs immediate attention. And so they admitted me on that Sunday night. Then in the morning of Monday, they came to take the samples. But they started the treatment even before the result came out. So by the time I got the result, actually I was on my way out of the isolation center when the result finally came.
Okay. So can you share with us your recovery process and what was the experience with doctors and nurses at the treatment center?
I was admitted right away on that Sunday when I went there, and treatment started. Maybe you want me to describe how it was, the whole place, the whole regime. The way it is done is that every morning somebody will come and clean your room with some kind of fumigation or some kind of cleaning
protocol, a disinfection protocol.
And then somebody brings your breakfast, and then the nurses come with your drugs. They test you, they check your BP, your temperature, other things. They ask you questions. Later, a doctor will come and talk to you, ask you, I guess, somebody, and then somebody brings your breakfast, and then the nurses come with your drugs. They test you, they check your BP, your temperature, other things. They ask you questions. Later, a doctor will come and talk to you, ask you, I guess, somebody. After they talk, write something down paper so others read up. Because when the doctors and the nurses come, you see that they are well informed. They already know about you, so they will check your temperature, your BP, and other things. And then the doctor will come. Then in the afternoon, the nurses will come again to take your BP, your temperature, and other things, and ask you questions and write them down. Sometimes another doctor may come, and then later in the evening, the nurses will come again. So the nurses come 3 times a day. Doctors may come once or twice in a day, depending on how serious that you think your case is. And of course, like I said, they bring your drug in the morning and in the evening. I'm sorry, I don't know the name of those drugs, but they have they are very strong drugs that as soon as you take them, you start feeling terrible, very, very weak, and even sleepy, But when they wear off, you become your normal self. But when you have to take those drugs, and I'll tell you an experience on my first Tuesday there, on the Tuesday after I got there, I think just before they brought my dinner, I was a bit hungry. So there was cornflakes and milk on my table. So I took it. Not long after that, they brought the dinner and my drugs. So I took the drugs. I did not take the dinner that they brought. And I went to sleep. I thought I was okay. I woke up in the night to go to the bathroom. And luckily, the bathroom, you have to actually go outside. So I went outside to the bathroom. And when I was done, I got up and then fell down in the bathroom. So I got up again. I struggled to get up, came outside of the bathroom and fell again. But luckily for me, a patient next door to my room was sitting outside. So she raised an alarm, and the nurses quickly came and took me to my room, stabilized me, applied the first thing they did was, after stabilizing me, they applied after taking me to the room, the first thing they did was bring in the oxygen cylinder and try to apply, but they found that I didn't quite need it. But one good thing I think they did was that they stationed an oxygen cylinder permanently in my room throughout my stay there. Though I didn't need it till the end, but at least it was there. If there was an emergency, somebody would have been able to apply it immediately. And then, so what it meant for me is that, and as they asked me, you haven't eaten your dinner? I said, no, and unfortunately, I don't really eat much. So that time I felt I was okay. So they counseled me seriously that these drugs are very strong drugs. It's good for you to take your drug. Even food is very important to your treatment. Food is you see the food is, it's quite big. For me, it's a lot of food, but I think it's measured to be sure that you eat properly, because those drugs are very powerful drugs. So those were the experiences I had, in the place. The drugs were the food comes regularly, the doctors come regularly, the nurses come 3 times a day. Your food comes at the appropriate time, and they are watchful. In my own section, there were about, I don't know, maybe about 20 rooms, across, and right opposite us, those people sit down there, I think 24 hours, just looking at our doors, in case somebody comes out and raises an alarm, so they can quickly address, help you. That is what I saw. But in the ICU areas, I didn't go there. They didn't allow us to roam about, But where I was, I saw that there was, they paid attention to us, and as soon as they thought we needed help, somebody showed up quickly.
Okay. How many days did you spend at the isolation center?
Okay, I went there on a Sunday and I was discharged the following Sunday. Okay. So that's about 8 days.
8 days. Okay, some survivors have said the treatment process is not as complicated as being portrayed. What is your view about this?
Well, I don't know about that. Like I've described my own experience, the drugs are, I recall counting the drugs that they gave me sometimes. I counted about 17 sometimes. Wow. I think when I was initially admitted, 1, 2, 3, 4, 5, 17. Wow. Some could be 2, but they're about 17 sometimes. But later on, it was reduced to about, I think 7 or 9 or so, when I guess they felt that I was getting better. And like I said, my own experience, I don't know about other people, my own experience that the drugs, they wear you down. You feel drowsy. You want to sleep, after taking the drugs. And I suggest and I suspect that is why they think you must eat well. And so that's why they give you good food in the morning. Regularly, the food come in the morning, in the afternoon, and in the night. They bring the food regularly, and the food is plenty. Though I'm not always able to finish it, but I suspect that they bring the food just to be sure that you have enough in your food to be able to, because of the strength of the drugs that they admit. Like I said, I don't know of the drugs. But I think regarding the drugs, they are very powerful drugs.
Okay, let me bring you back a bit. When you got your results, did you think about how you contracted the virus? Were you out of the country for a while? Did you think about all that?
Of course, you will think, but if you ask me, I have no idea. I did some research later, and I found out that you can't be too careful. Look, if anybody was trying to protect himself, I was one of those people. I don't mix with people. I don't go out. I don't do. I stay in the house. But again, you still have to go out once in a while. Your vendor brings newspaper, you don't know. Other people enter the house where you live, you don't quite know. You go out to the bank, to the ATM machine, you try to distance yourself from the person in front. Somebody behind you does not, and is not wearing nose mask. And if you try to talk to them, they may be rude to you. So you just take it easy, you keep quiet. So you go to I even decided that, okay, let me be going to these to buy my groceries from, I don't want to mention names, some of these big grocery stores. But somebody else tells you that, look, supposing even the trolley that you use in carrying your groceries, somebody may have touched it and you have no idea who that person is. Even when you go to the aisle, maybe you take Belvita or you take cornflakes or whatever you take, somebody else may have taken that thing and returned it. You have no idea. So if you ask me, I'm one of those people who have been extra careful. You know, so, and if it happened to me, I guess it can happen to anybody. Which now takes me to what is called community transmission, which means that it's very, very common now, you know. So if you think that you can only get it if you have contact with people who just came from abroad, you are lying. The thing has gone round. And the worst part of it is that a lot of people already have it, but they are asymptomatic. They don't show any symptoms. So they themselves do not even know that they are ill, that they have it. And so when you see them, they are healthy, they are strong, they don't complain about fever or anything. So you naturally will, you know, mix with them. You have no idea. Because they themselves don't even know that they are ill, or they have the virus because it doesn't show on them. There are people like that. So I like to think that anybody around you could just have even those of you in the studio, you never know. You know, you can only speak. You can't even speak for yourself because you don't know your status until you test. You know, so that is what I think about it.
Okay, so
I have no idea. If you ask me, I don't. So a lot of people are asking. I'm looking at them like I have no idea. I mean, how would I know and deliberately go and expose myself to someplace? No, I didn't. But it happened.
Okay. Well, I have been talking to Lekan Sote, a journalist, broadcaster, columnist with the Punch newspaper, who conquered COVID-19. I am sure his experience has dispelled some myths and misconceptions about the virus. We will bring you the concluding part next week. Sound Health continues with trending health news. Please stay tuned. That is it on Sound Health this week. For comments and inquiries, please send SMS to 08035826603 or follow us on social media at LTV Social, #Sound Health. A sound health is a sound mind. Make healthy living your choice.